some of the medical terminology defined for you guys. Hey everybody, as you guys know, I am doing an exercise and I am studying Kanika's autopsy report, and I found something that caught my attention. I had heard it before, but it didn't hold much weight until I dove into the autopsy report for myself. I don't know the significance of this, but I'm just going to read to you some of the information that I found. Okay, and it is it comes from the respiratory system, and I'm going to read to you what it says, and then I'll read to you the information that I found about that particular situation. And it says, the upper airway is clear of debris and foreign material. The mucosal surfaces are smooth, pink tan, and unremarkable. The pleural surfaces are smooth and glistening with no focal lesions. The pulmonary parenchyma is deep purple, exhibiting slight to moderate amounts of bloody fluid upon successioning. No mass lesions are noted. There is mild anthracosis. The right lung is bilobate. No middle lobe is present. The pulmonary arteries are normally developed, patent, and without thrombose or embolus. The right lung weighs 238 grams and the left lung weighs 193 grams. Well, what caught my attention right here is when it says the pulmonary parenchyma. I'm not sure if I'm pronouncing that word right, but the pulmonary parenchyma is deep purple, exhibiting slight to moderate amounts of bloody fluid upon successioning. So after I read that, I went to I looked up pulmonary conditions found at autopsy. In this, I'm gonna just read this to you. And it states there are immeasurable conditions that may affect the lungs, producing findings that can be found at autopsy. In the United States and other developed countries, some of these conditions are common, while others are relatively uncommon or even rare. Despite the rarity of some of these conditions, they may be of key importance in certain cases. Vascular congestion, edema. Vascular congestion of the lungs is by far the most common lung finding in autopsies. Vascular congestion is congestion of the lung blood vessels in excess of normal blood and fluid settling, livor mortis, lividity or hypostasis with normal, which is naturally occurs in the postmortem interval. Both congestion and edema of the lungs are conditions that may result from other conditions. Heart failure, as an example. Pulmonary edema is a term that refers to fluid accumulated in the air spaces and other lung tissues. Severe pulmonary edema can cause impaired gas exchanges, respiratory failure. Pulmonary edema is of two main types. Cardiogenic pulmonary edema is a backup of fluid and blood in the lungs that is due to the failure of the heart's weakened left ventricle to remove blood from the pulmonary circulation. Non-cardiogenic pulmonary edema is caused by direct injury to the lung tissue or blood vessels. Typical situations where acute pulmonary edema and congestion may be seen are cases of drowning, certain cases of drug overdose, and injury to the lung due to the inhalation of noxious chemical fumes. Acute pulmonary edema can lead to respiratory failure, hypoxia, cardiac arrest, and death. Chronic pulmonary edema is often caused by congestive heart failure. When the weakening of the heart is not able to pump efficiently, blood can back up into the veins that take the blood through the lung. As the pressure in these blood vessels in the lungs increases, fluid is pushed into the air spaces. They may be whipped into foamy, sometimes pink-tinged secretions in the airways, normally airways, nasal or oral cavities. Okay, so I just wanted to give you guys some insight about what I'm reading and the information that I am coming across. I cannot put this together right now. As I have it in my brain, I need to get a clear understanding of what I'm reading before I present it to you guys. But I just wanted to let you know that in the respiratory system, there is something that needs to be looked at much more closely than we have before. Okay, guys, I'm going to continue my study, and I'm going to come back to you guys, when the time presents itself. Thank you guys, and have a great evening.